Welcome to the Health Daily Show, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Andreas Mang, Blackstone Senior Managing Director and Equity Healthcare CEO. Andreas, welcome. Thank you for joining us.
Thank you. It's great to be here. Appreciate the opportunity.
Blackstone is the world's largest alternative asset manager with about $1 trillion in assets under management. You've got about 230 portfolio companies across various industries. When private equity companies invest in portfolio companies, they do so because they want to run their operational playbooks, whether it's accelerating revenue, upgrading talent, optimizing productivity and cost. Where does equity healthcare come in for Blackstone?
Yeah, great question. So we sit within the portfolio operations team, as you just sort of described at Blackstone. We have a very well-organized operating team with incredible depth across a number of areas. But interestingly, our team was actually one of the first capabilities added to the operating team about 13 or 14 years ago, which is interesting because there's a lot easier things to tackle other than healthcare, right? But I think it speaks a bit to the DNA of Blackstone. It speaks to the DNA of our founder, Steve Schwarzman, who kind of no problem is too big to solve. And so we were actually the second capability, again, added to the operating team years ago to address the issue of healthcare across the portfolio.
So how does this exactly work in Blackstone's playbook? What's the magic you run bringing in healthcare cost reduction?
Yeah.
Talk about the pain points you're solving for in your portfolio companies and how you're a critical ingredient in this Blackstone playbook.
Yeah, I mean, it's a huge ingredient. We're deployed kind of one of the, I'd say, base sort of solutions in the portfolio team where we're sort of deployed across all of our companies. Healthcare is very unhealthy in the US, right? We've sort of all accepted that. And our whole sort of reason for being is to deliver solutions to the portfolio which enable healthier healthcare. Okay, that's sort of the way we can summarize what we're doing. So we're a solutions provider. It starts with our team. So we have a very small team, but it's a very small but mighty team, I like to say. There's 6 of us. We have an actuary on our team. We have a pharmacist. We have a healthcare data informatics lead. We have some support folks. But most of us, the senior leaders on the team, are all ex-health plan senior operating executives. And so if you think about the companies that I tend to work with are our self-insured companies. Right? And the way that we have framed self-insurance to our companies is risk has been transferred from the health plan to you. Guess what? Congratulations. You're now running a little health plan inside of your business. And when you start to think about it that way, it sort of opens your mind to both the weight of the issue, but also the resources that you need and the expertise that you need. And so what our team brings to bear as a bunch of ex-health plan operating executives, right, what we can bring to our companies sort of the ideas, the solutions, the knowledge of how to actually manage risk at a company level. And we've had a lot of success doing that. So we focus on 4 key buckets. We focus on sort of community, leveraging the size and scale of our portfolio, bringing innovations, collaborations. We focus on cost and controlling that. We'll talk about that. We focus on sort of concierge service for our companies, and we focus on equity.
Bring it to life. Make it more tangible. Talk about some of the outcomes that you've actually driven, whether it's 20% cost reduction and how you actually tackle it.
Yeah, so we've demonstrated incredible results. So to hit the sort of the headline, our 13-year medical and pharmacy inflation trend is sitting right now at 1.9%. In addition to that, our employees and dependents that are using the solutions that we've put in place are providing an NPS to our carrier partners, we'll talk about who those are, with an NPS of 80. And so we're controlling costs almost in an unheard of way across an incredibly diverse group of companies where we're not dictating things like plan design. We'll talk about kind of how we're getting at it. We're eliminating some clinical waste. We're getting at some cost issues. And we're also giving our companies something that's delivering a lot of value to their employees. So sort of the workhorse of what we've built on the self-insured side. We're partnering with 2 national health plans today. We've gone in and said, look, as a bunch of ex-health plan executives, we know what you can do. We want to pull forward the best of what you do for your fully insured book We want to turbocharge pieces of that. And then we want you to customize uniquely for Blackstone certain other processes. So the way that we deliver care management for our companies, okay, our carrier partners are doing it differently than they normally would for their self-insured companies. And what we've done is we've created our own ecosystem completely dedicated to Blackstone that has amped up clinical care management. We have nurses and physicians and behavioral health specialists and social workers completely dedicated to our companies, delivering care management in a way that's different than what health plans typically would do. We couple that with a service model that is an entirely sort of concierge navigation-based approach. So for those that aren't sick, who just need to call in and get some help, they're getting a different level service experience. So our care management approach has been able to wring out some of the excess costs, some of the waste. Obviously, our size and scale gives us some pricing power. Currently on our platform, we have about 250,000 lives. We're managing about $2 billion in spend. And by 1/1/24, we have a line of sight into that. We're going to be about 80 companies and about 300,000 total lives that we're managing. So we're doing this at scale. And we're big enough where it makes economic sense for our carrier partners to do some of these customizations for us.
Talk about some of these outcomes that you're driving and how you're measuring it. So whether it is improving the health outcomes of this ecosystem of the number of the employees across the portfolio companies as well as Blackstone. So talk about, tangibly over the last couple of years or even on the go forward, the impact on actual health outcomes, reduction of cost, the access dimension.
Yeah, so let's, I just mentioned trend, right? We've been able to suppress cost, and we're not doing it in a way that obviously is taking anything away from our companies. It's interesting, our approach is decidedly an investment model, right? We're wrapping our companies with a level of clinical support that they typically would not get on their own as a self-insured companies. Our typical investment is a few thousand employees. Those aren't small companies, but in the world of healthcare, as a purchaser, that's tiny. And so to aggregate them together, right, gives us a lot of that purchasing power. So we're wrapping them in clinical resources. What we're seeing, lower readmission rates, lower days, lower, admissions. The readmission thing is really important. I'll give you an example. Someone who's going through cancer treatment, one of the number one reasons for readmission is associated with dehydration from nausea, right? From going through chemo. Imagine having a nurse attached to you who's trained in oncology, who's checking in on you every day, who's saying, "Hey, Chitra, how you feeling today?" "I'm feeling nauseous. I can't hold down fluids." In the normal world, that person's probably left alone and has a high likelihood of ending up back in the hospital, right? In our world, we have a nurse checking in on you every day. "Oh, you're not feeling well? Let me call your doc. There's medication for that. We'll get you a med to suppress your nausea. Now you can hold down fluids. You don't get dehydrated. You're not back in the hospital." So those are like some real life examples that are happening every day in that world that we've created, which we're really proud of. So it's very much an investment model, which is maybe a surprise for people who look at private equity and think all we're, total bottom line focus, trying to strip out costs. But in doing so, it has proven to reduce one of the biggest line items for a company, healthcare cost.
So you talked about private equity. There's a perception that since you're Blackstone, you can, pound your fist at the table and everyone's going to magically just do what you want, right? The reality, though, talk about who are all these diverse stakeholders that you've got to get to the table and aligning these stakeholders and aligning incentives.
I exist in a really interesting bubble, right? As investors in our company, we have instant alignment, right? And I also think we get a lot of runway around trust. And when we invest in a company, there's typically an openness to change, right? So from a process perspective, my team is involved day one during diligence. If we're looking at something that we're seriously going to invest in, my team is brought in, and we're already meeting the HR and management team of that company. They're starting to hear about what we bring. We're able to sort of calm down any of the concerns, if there are some, around what we might be doing. We meet them in the beginning, and then the minute we sign on a deal, our team's typically one of the first that's deployed in. And we don't force anything. The only ask we ever have when I walk into a new company, all they ever hear from me is, my one ask is that we look. We look at what you have in place today, we look at our solutions, we do a proper RFP, let's let the data tell us what the best next move is. Maybe it is one of our carrier partners, The vast majority of the time it is. It ends up being a better option for them than what they have on their own. But look, in certain instances, it might not be. You know, if you're a company, we had a mining company, you know, that was basically located in Montana. The carrier partners we used weren't really strong in Montana, so we left them alone. It didn't make sense for them to join what we built. But alignment really comes from having investment, from having ownership, having an openness to change, and actually us not coming in and being sort of heavy-handed, but instead laying out options and saying, let's look at this together and decide what's the best next move.
How do you get the carrier partners bought in?
Oh, that's probably been the easiest thing to solve, because when you have our size and scale, it makes economic sense for them to want to work with us. Plus, you mentioned Blackstone, we just hit $1 trillion in assets under management. We are on a growth trajectory that they get to enjoy the benefits of that. So as Blackstone grows, they continue to get opportunities with our companies. And so it really is a win-win. They're doing incredible things for us. And the flip side is they get to enjoy sort of the upside of being a partner of Blackstone.
With this captive ecosystem of about 300,000 employees across Blackstone and the portfolio companies,
Yep.
A path to value-based care?
That's a tricky one, Chitra. So look, we leverage value-based care in a couple of key spots. When I started my career, I was in Massachusetts. Everyone was capitated. That's value-based care, right? So I've seen that. It obviously went away, and now it's trying to make a comeback. It's going to take a long time for value-based care to sort of be distributed at scale, and so we're trying to be smart about taking advantage of it where we can. But what I'll tell you is we alone, despite 300,000 lives, we're not large enough to walk into a single market and say, hey, let's do something interesting with some of the larger health systems. Let's say we had a massive presence in Orlando. Could we reach out to Orlando Health and try to do something direct? In theory, yes. The reality is 300,000 lives spread nationally is kind of a nothing. Even though we're one of the largest purchasers of healthcare in the country, we're in any one geography, we're pretty distributed. So we are relying on partners. We have a relationship with a company called Centivo, who's doing value-based care. We are working with a very innovative diabetes, it's actually a metabolic health company who's having tremendous success with reversing type 2 diabetes, called Twin Health. They're completely value-based. They only get paid on outcomes. So in those spots where it makes sense, we take advantage of it. But we're not kind of holding out hope that tomorrow the entire health system is going to be transformed and value-based care is going to be ubiquitous and all problems solved. Like that's probably not going to happen in my career. So we're picking our battles where we can.
Leadership. In career business life, there are rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
I don't know if I'm a code breaker per se. I have taken a very strange career path. I've taken twists and turns that I never imagined. Never once in my sort of idea of my career did I envision ending up at Blackstone, let alone becoming a partner here and leading the team that I lead. My business school friends joke that out of our entire class, I was probably the least likely to end up where I am. And so I've taken a bunch of risks. I was sort of on a steady path on the payer side for almost 2 decades. And at one point I decided that I wanted to try something new, and I took a right hook, and I was in my mid-30s, newly married, first kid on the way, and I asked my wife, how do you feel about leaving Boston and going to Hartford, Connecticut to go do a startup? So at that point in my life, I took a 50% pay cut. I took a bet on myself, and we built this amazing company that I'm really proud of. But had that not happened, I wouldn't be at Blackstone today. And so for me, it's just been about taking, I think, smart risks and being willing to take those risks. And amazing things can happen when you sort of do that. And that's not for everybody, right? It's just not for everybody.
Andreas, thank you so much for joining us.
Thank you. It's been a pleasure.